Hey everyone, welcome to Lillian Live in New York with Well World TV. I'm so glad you guys are here. We have another amazing guest today. Her name is Shannon Mahoney. She's a physical therapist here in New York City. She's my physical therapist for a few years. She is awesome. Hence the title of our show, All Those Aches and Pains, Taking Care of Your Physical Health Now, because it's just as important as your mental and emotional health with everything going on and, going into the winter with the COVID numbers going up. Shannon was born and raised in Rockland County, New York, and she had a desire to help others, which was instilled in her at a young age. She went to college in Boston, Massachusetts, where she began her career as a physical therapist. After 6 years, she made her way back to New York and began working for professional physical therapy on the Upper West Side, where she has been ever since. And that's where I go as well, because I have all these back issues. She works with a range of patients from necks to feet and everything in between. Shannon has a passion for keeping people active and getting back to the things they love to do pain-free. You can reach Shannon, and I'll put that information up a little later. But just for now, I'll let you know. You know what? I'll put it up in a little later after I bring her out. So without further ado, here's Shannon. Hey, Shannon.
Hi, Lillian. How are you?
I'm good. How are you?
I'm good. Good to see you.
How's everything? Yeah, how's that? I never see you with your hair down. And you never see me with my hair down. We're always in workout mode.
I know, and masks on.
And masks
nice
on,
to see
right?
your whole face.
Right. You got some nice teeth over there. I had no idea. So, how was your day today?
It was good. It was a pretty usual day. I'm commuting from Stanford, so got up nice and early and then came home, made some dinner, and now here we are. But yeah, it was a good day.
So, how many patients do you currently see now?
Each day it varies a little bit, but I would say in an 8-hour day, somewhere between 12 and 15 patients or so, give or take.
Wow.
We schedule on the half hour, so it comes out to about that, depending on the day.
And
with the rain,
sorry, go ahead.
No, I was going to say, with the rain coming today and tomorrow, we may see a little less, scares people away a little bit.
I know, like the rain is going to melt us. So out of these 12 to 15 patients a day, how many, do they all have like a common theme? Because I know the other day I saw you working on someone who had weights on her ankles. Sometimes I wonder, what happened to them?
Yes, I know. People always love to ask, but we can't really discuss specifics about other patients. But we see such a variety, especially in New York. So we can see anyone from, you're there for your back. I have, around the time you come, I may have someone there for their knee or their shoulder. Some people are going to be post-operative. Some people are going to have chronic pain. Some people are going to have a recent injury. So it really varies. And we like to specialize our treatments to the patient. We don't like to use the cookie cutter model where every back patient's going to get the same thing.
Right.
We like to make sure that everyone's program is directed to them and their goals. So
that's terrific. And how long, more or less, does it take for the course of the therapy for them to really start to see results?
So I like to use the 1 month mark as a benchmark, meaning I like patients to start to see real improvement in their function, their pain levels within 3 to 4 weeks. If they aren't seeing any improvement, it's not necessarily something that we're doing or they're doing wrong, but it may be something else that we may send them back to the doctor to have the doctor just double check. Are there any things we missed, or is there anything else going on that they may not have caught? Now, sometimes they'll find something else, they'll try a different route, and sometimes they'll send them back and they think, they just need a little bit more time. So it depends, but I would say I like to see patients have some sort of relief within the first 3 to 4 weeks.
Do you ever have a patient that you do physical, not you yourself, but physical therapy is performed on and they get worse?
I mean, it can happen. I would say it rarely happens, but it definitely can happen, And I think just making the patient aware I like to start all my patients on the first day, start slow. We do hands-on treatment, give them some stretches, give them some exercises, see how they're going to respond. If you give someone 10 new things to do on day one and they feel worse, I'm not going to be surprised. And I'm also going to have a hard time figuring out what was it that actually caused them to be in more pain. So I think less is more, especially at the beginning. And then as patients start to feel better, you can integrate more exercises. And I think just educating the patient on that at the beginning so they're aware. They don't feel like you're just giving them 2-3 things to do, even if they're someone who's active and likes to exercise. So just making sure that they're aware of your plan for them and why you're doing what you're doing.
So in the case, I just hear an echo. Not sure what that is. In the case of, it just went away. In the case of somebody, for example, like me, where I go to PT twice a week, but I'm religious about doing my exercises every day. Can you, if you have somebody who comes to PT but doesn't do their exercises, is it going to take longer for them, or?
Yes, and I would say that tends to be about 50%, if not more, of the patients don't do what we give them to do at home, unfortunately. And we can usually tell. But yes, it usually does take longer because if you think about it, you're in the clinic, most people 2 to 3 hours a week. So say you come for a 1-hour session, 2 or 3 days a week, there's a lot of other hours in the week that you need to be doing something, So I think every day, or at least every other day, especially at the beginning, it needs to become part of your routine. And if it doesn't, that can be part of the problem where people feel like they plateau or they're not getting better. So yes, but that's very common. And I would say the more you do, the better off you'll be. And at the end of the day, it's the patient's decision. It's their life but we're just trying to help them the best way we can. So
do you think that that everyone is destined to have aches and pains?
I mean, I think at some point in their life. Now, people always ask, is this ever going to go away? And, I don't know, but our goal is to get people to a point where they can function day to day with minimal to no pain or minimal to no limitations. Now, yes, certain aches and pains may be chronic and people may decide someone has arthritis in their knee. The only way to get rid of the arthritis is to have surgery and to have that joint replaced. Now, someone may say, it's not bad enough for me to want to go through that surgery and that rehab. So in that case, I would say they're going to have some aches and pains, and that's part of that diagnosis and part of the decision not to have surgery. So yes, I mean, I think everyone at some point in their life is destined to have some sort of aches, pains. We all do things and whatnot that, may influence that. But I would say overall, yes.
I get jealous when I don't know what that noise is. There's like some kind of noise. Anyway, I get jealous when I hear somebody who's like 65 who tells me they've never had any kind of back pain. And I'm wondering, I don't understand it. Like, I'm not lifting anything heavy. I go to make my bed and my back goes out, like where I'm out of commission for a week. And I don't understand it. I don't get it. How this, yeah.
I know, it's definitely frustrating, I think. And I would say, the other thing I'll say is, everyone's perception and tolerance to pain is different.
Mm-hmm.
So, some people are going to tolerate pain a lot more than others, and some people are going to cope with pain more than others. So, I'm sure some people have had some aches and pains. Now, in your case where you're out of commission, now that's not ideal.
Right.
But yeah, I mean, I feel like most people at some point have some sort of ache, pain.
Yeah. What about the fact that, I used to wear, like high heels, like, does that have something to do with this stuff? Or does everybody that has aches and pains, like, do they all, anybody that wears heels, are they getting aches and pains, or is it,
I think it depends. Yeah, I think it depends. I would say I would say your heels probably aren't the reason you have this back pain. Now, I wouldn't recommend you wearing those heels right now, but hopefully in the next few months or in the new year, you can get back to wearing some of those. But, when you're recovering from any back, lower body injury, heels, unfortunately, are not the smartest decision. But they usually, I would say, aren't the main cause of anyone's aches and pains unless you trip and fall in them or something like that, which I've had patients do. So
yeah. So who takes care of you? How do you keep yourself, intact when you're taking care of everybody else?
I know. Well, they say PTs are the worst patients, which they are. But I'm lucky to have good coworkers that I can go to have work on me here and there. But I'm definitely one of those people that doesn't keep up with my home exercise program as much as I should. So
yeah,
my aches and pains tend to come back pretty frequently, especially since I'm using my body all day for work. So
yeah, we need you. You have to take care of yourself. So you think that now more than ever, it's really important to pay attention to the physical, because obviously we're all being challenged mentally, emotionally, and what's your take on that? And my second question is, how did you deal with COVID, and how are you dealing with it?
yeah, so I would say the best part about physical health exercise is it's a way to kind of relieve stress and relieve anxieties about the world and everything that's going on right now. And I would say that, most people, you feel good when you exercise. You feel like you're releasing something. And especially if you come to physical therapy and you're experiencing some sort of pain, or, you had a recent surgery and you feel some progress, you get, that's something positive in your life right now, which, we're in a crazy world right now that no one could have planned for.
Right.
So I think exercise and all that is so important. And I would say, I mean, for me, coping with COVID, just like everyone else, just trying to do what I can, do my part. And I'm lucky that I have a job where I am in person. So my normal, other than wearing a mask and, taking the precautions that we have to take, I'm still going to the office every day, working my normal day. So I think for me and my sanity and my mental health and everything, it's actually been helpful to be in the office. And I know people that are working from home are starting to get a little bit crazy. And obviously a lot of our patients are working from home. So, I hear it all day about, people and how they're kind of coping and not coping with the crazy world. But it's nice that we're able to be there for people and we're kind of an outlet for people. It's kind of their one thing to do, during the week, their one routine that keeps them out of the house and on track.
We should add to your title over here, S. Mahoney at psychiatrist, professional PT, right?
Yeah.
Because I know when you're in that field, a lot of times you're listening to people and that's part of who you are. You're right. You want to help people. That's why you got into this profession.
Definitely.
Yeah. Now, what about difficult people? Do you have any difficult people, and why are they difficult, and how do you deal with them?
Yeah, there's definitely are. And I would say, in the grand scheme of all the patients I have, it's a small percentage that are really difficult. But I think, some of that difficulty sometimes comes, patients will be difficult at the beginning. They're nervous, if they've never been to PT before, they're in pain, especially during COVID, people are very nervous about going to a doctor's office, going somewhere. So I feel like once they're more comfortable, they become a little bit more, less concerned and less difficult. And, but I would say, some people just like to be difficult. So you learn to deal with it. You deal with a lot of personalities, and then I would say some people just have difficult cases, where things just don't seem to get better, and it's frustrating, and they're frustrated and you're frustrated and the doctor's frustrated. So I think just working with the patient and just making them aware that, everyone's doing their best to get them better. And it's just, we're doing everything we can and hopefully we'll get them to that point. But I would say overall, we have good patients, and I really enjoy working where I do in the city. And I learn a lot from my patients, just like they learn a lot from here. I hear good stories and I can take a lot from that. So as difficult as sometimes the job is, it's worth it.
So what's one of your best stories that, like of your so far of your PT career, when you started in Boston to now, like, do you have any stories that stand out that are really good stories?
Oh, well, I feel like, discharging a patient based on them meeting their goals is always the best thing that could happen. But I would say, like, in the last few months, I would say I had a really unique case, a young girl, early 20s, having a lot of numbness in her arm, kind of nothing really showed up on an X-ray, MRI. And it took us a while, more than a month, that I would like to kind of see any real, like, consistent improvement. She would get better, and then 24 hours after her session, it would kind of come back and nothing stuck. And finally, we were able to get her to be able to, go weeks. And, now, as far as I know, nothing has come back, but without that numbness in her arm. And, being so young, I think it's scary to have something like that. And she was active and in shape. And, we never really got to the bottom of why it necessarily was happening. We kind of guessed at it, but hopefully with the adjustments and modifications we made with her work setup at home and the exercises she was doing for her own, on her own time, that hopefully, it will stick. But I would say that, that was something recently that was a very tough case that was interesting, and it was, required a little more problem solving than the average case.
And what about what's the worst, like, what's the worst scenario you've seen? Like, whether it was an car accident or, like, what's the worst case scenario that you've seen?
I would say there's one that sticks out to me, which was a car accident. This was not in the clinic I work in now. This was actually during one of my rotations back in college, but someone was in a car accident and had to have part of their leg amputated. So that was probably the worst thing I've seen. But obviously that's the minority. But, they got through it, and, they are doing well as far as I know. I mean, this was years ago now, but when they left, they were, pretty independent and functional. And, but I would say, in the city, I haven't seen much that's like crazy or anything, but I've had patients who, fallen off a bike or something, and they dislocate their shoulder, and then they also, like, fracture their knee, so now they have two things they have to deal with.
Wow.
So that you see some of that, which is more common. That's unfortunate. But
so in the case with the person missing a leg, you're working on their other leg and also helping them to maneuver with a prosthesis?
Yes. So it's a mix. Obviously, that's a long recovery.
Yeah.
And I wasn't even there for all of it because it was a clinical rotation. So I was only there for about 4 months. But, that's a long recovery. And I came kind of in the middle of it. So taking care of the prosthesis, showing them how to transfer from bed to wheelchair, from wheelchair to standing with just that one leg. And then eventually getting them fitted for a prosthesis and training them on how to walk with that and do all of that. No, I'm no expert in that. But my clinical director at the time had a lot of training and experience in that. So he had worked with a bunch of patients before. So it was a really good learning experience for me. I would need a refresher if I had a patient that was that acute now, but yeah.
Were you in Boston when was the bombing?
I was marathon? Actually.
Oh, did you see anybody from there?
I didn't actually. No, I really didn't. But yes, I was there for it, unfortunately, and that was a crazy time.
Were you watching the marathon outside?
I was, but I was at a different part of it. I was over by Boston College, which was actually about 5 miles away from where the finish line was. So, wow. But I was living pretty close to there. My college was about a mile away, so I ended up leaving the city for a little bit and then came back.
Yeah, that's scary. Well, let me ask you, do you have any tips to recommend to anybody, on what we can do, like in our apartments, in our homes, to maintain healthy, to make, so that we're not, to prevent the aches and pains in some way?
Right. I would say the thing that we've noticed a lot since, the last few months, or close to a year now, since people have been working from home. At the beginning, people didn't think this was going to be a long time. People didn't have the proper setups at home. So we've had a lot of neck, upper back, low back pain. So I think just being mindful of your setup at home is really important. And then making sure you have good posture and whatnot. And also just taking the time, even if you have, 5 minutes in the day. I always say to patients, I'm like, I don't need you to do every single exercise every day, but I need you to devote 5 to 10 minutes. And these are the most important things. So I think even if you're not someone who is going to physical therapy and has aches and pains, just stretching, doing some core exercises, doing some postural exercises. You can feel free to reach out to me at this email and I can, make some suggestions. But there's a lot you can do and you can make a big difference in just 5-10 minutes of your day. And I would say too, I just find, getting outside, even if it's, it's getting cold, it's going to get colder soon. And I think just getting outside, clearing your head for 5 or 10 minutes makes a big difference in your physical, your mental, emotional health, all of that.
What about like a foam roller or like things like that?
Yeah, that can be really helpful if that's something you want to invest in and something you have space for in your apartment. That's good. You can do a lot of stretching, a lot of kind of like mimicking a deep tissue massage with that, mostly in the lower body. But that can be a really beneficial tool for someone at home. And it's kind of a quick thing, even if you're like on a call and not talking, you can stretch out a little bit from that.
Right.
So, I think that's a great suggestion.
Well, for those of us in New York City, we're challenged because of our small space. But I know everybody else who's watching them, they're not in New York. That's a good tip. Yeah. So I want to let everybody know, if you want to reach Shannon, you can reach Shannon at smahoney at professionalpt.com. And she is just awesome. And Shannon, I want to thank you for coming on today. This was awesome. And thanks for helping me get better. My orthopedic is telling me I'm getting much stronger because of the exercises that you're helping me with.
Good. Well, we'll keep working at it.
I appreciate it.
We got to get you back to running around.
Yes. So thank you so much. And hopefully I'll see you tomorrow.
All right. Sounds good. Thanks for having me.
Okay, thank you.
Bye-bye.
Bye. Okay, hang on. Hang on there.